Good morning, students. Here we come up with the gross anatomy lecture of the broad ligaments of the uterus. A very interesting topic, the broad ligaments of uterus. In the previous segment, I had discussed that broad ligaments are a part of false ligaments of the uterus. They are a pair of peritoneal folds. They are a pair of false ligaments belonging to the uterus. Now, broad ligaments are asked as an independent topic. So therefore, in the definition of the broad ligaments, they are on either side double layered peritoneal folds which will be attaching the lateral wall of the uterus to the lateral pelvic wall. Then we are going to discuss the presenting parts and we are going to discuss the subdivisions. And after the subdivisions, we are going to discuss, the last segment will be contents of the broad ligament. All these 3 points are very important. After the definition, these 3 points are very important. Definition, as I told you, they are double layered peritoneal folds which are attaching the lateral border of the uterus to the lateral pelvic wall, and they are embryologically remnants of the dorsal mesenteries of the paramesonephric duct. In fact, they represent the dorsal mesenteries of paramesonephric ducts. Then presenting parts. I will note down first, the presenting parts will be antero-inferior surface, please note down, and second will be posterior-superior surface. Why antero-inferior? We know that the uterus is having angle of anteversion and anteflexion as it is bent over forward. So therefore the surface anteriorly will be projected inferiorly. So antero-inferior surface and posterior-superior surface. Because of, if I draw here, this is just a line diagram, and here if we show, this is the cervix and here this will be the uterus. So because of this bent angle, the anterior-inferior surface is directed inferiorly, so it is called anterior-inferior. This is posterior surface which is directed upwards. This is the uterus, this is vagina. Very short line diagram to understand these two surfaces. Then we come across two borders. Borders of broad ligament. Now remember, the anterior-inferior surface and posterior-superior surface is related to the broad ligament, and the broad ligament itself is attached to the lateral border of the uterus. So therefore the broad ligament will have anterior-inferior surface, posterior-superior surface, just as the uterus is bent forwards. Same way, after these two surfaces of the broad ligament, now the borders, four borders. Remember, the four borders will be medial, lateral, then there will be upper border and lower border. Lower border is also known as the base of the broad ligament. So there are four borders. These are the presenting parts. Four borders and two surfaces. Then subdivisions. Subdivisions will include here mesosalpinx. Second one will be mesosalpinx, mesometrium. Third one will be mesovarium. Mesovarium, and fourth will be the infundibulopelvic ligament, or it will be known as suspensory ligament of the ovary. These four structures are the subdivisions of the broad ligament. And finally, contents. Contents we'll discuss later on. Now therefore, we come on this side, we'll take this up of the board, and we are going to draw only one side. Please draw here. We are going to complete only the one side of the uterus. This is the cervix, and we are going to draw on even on this side. Now this is the uterus, this is the cervix over here. This one will be vagina. So therefore, lateral wall of the uterus. And we are going to draw here fallopian tube. Only on one side we are going to draw this fallopian tube, and we are going to show this fimbria. Please show it in this way. And we are going to draw here, this is what we are going to show, the ovary. And now here, after this ovary, we are going to show the ligament of the ovary, which will be connected in this direction. This will serve as the ligament of the ovary. After drawing this much, now we are going to show the broad ligament. So the broad ligament, we are going to draw The broad ligament we are going to fill here with yellow color. I am going to fill this entire region. I am going to fill with yellow color, and this will serve as the broad ligament everywhere. And the lower border, I am going to show the broad ligament. This will serve as the lower border. This is the lateral border. This will go as the lateral border. This is the lower border of the broad ligament. And we are going to now color the entire broad ligament. This is the broad ligament which I am coloring. And here we come across this portion, this where I am coloring. This is the lateral border which will be attached to the lateral pelvic wall. And this broad ligament will even extend above here, superior border. Now this is the superior border. Here I have marked the superior border of the broad ligament. Very simple. It is basically very simple to understand. And here I will highlight this fallopian tube. This is the fallopian tube. So therefore, our broad ligament is complete. Now let us understand the presenting parts. Anterior-inferior surface. This anterior-inferior surface, supposing this is the anterior-inferior surface which I am showing where my hand is there. Relation of anterior-inferior surface of the broad ligament will be with urinary bladder and paravesical fossa. Please note down these 2 points. So anterior-inferior surface of the broad ligament on both the sides will be related to urinary bladder and paravesical fossa. Then we come to posterior-superior surface, just behind, posterior-superiorly. Posterior-superior surface, remember, it is related with ovary. Although ovary we have drawn here, but we have drawn this ovary to show that we are looking at the ovary from the front. We are looking at the ovary. And imagine it is a see-through, transparent broad ligament. So therefore, posterior-superior surface of the broad ligament is related to anterior border of ovary. That means ovary is related to the posterior-superior surface of broad ligament. Note down, it should be kept very clearly in your mind. The anterior border or the ovary itself is related to the posterior-superior surface of the broad ligament. Therefore, this ovary is related to the posterior-superior surface of broad ligament. And second structure which is related will be this opening. The fallopian tube will have a pelvic opening. This is the pelvic opening of fallopian tube where my hand is there. So this pelvic opening of the fallopian tube where my hand is there, it is perforating which layer? The posterior-superior layer of the broad ligament. So therefore this is the structure number 2. As the fallopian tube is a content of broad ligament, remember fallopian tube is a content of broad ligament, ovary is not a content of broad ligament. Fallopian tube is present within the broad ligament, and therefore its lateral end, the pelvic end, will pierce the posterior-superior surface of the broad ligament and will enter, it will have an opening in the peritoneum. That is the peritoneal opening of the pelvic portion of the uterine tube. So posterior-superior surface of the broad ligament is related with 2 structures. Number 1, it is related with ovary, and number 2, there will be opening of which tube? The pelvic portion of uterine tube or fallopian tube. Please note down. So posterior-superior surface of the broad ligament is over. Now the borders. The borders will be, we start with the medial border. As we can see, medial border is related, it is attached to the lateral border of the uterus. Then we go to the lateral border. Lateral border is attached to the pelvic fascia. This is the pelvic fascia. Then superior border. The superior border is the only border where both the layers are continuous with each other. Both the layers of broad ligament will be continuous with each other at the superior border. As already in the introduction I had clarified that broad ligament, right and left part of broad ligament, each part will consist of 2 layers. So therefore at superior border, both the layers are continuous with each other, and this superior border will have a content which is known as fallopian tube. Although there are numerous contents, but in the superior portion, superior border where both the layers are continuous, will have this content as the fallopian tube. Then we come across to lower border, where my finger is there. This lower border will function as the base of the broad ligament, and it will be related to, what it is related to? 2 important structures it is related to. Although we have discussed this during the ligaments of the uterus. So there will be the presence of uterine artery. This uterine artery will be crossing in front of ureter, and the ureter will be present here. So the base of the broad ligament or inferior border of the broad ligament is related with two structures, the ureter and the uterine artery, which will cross in front of ureter and enter as a content of broad ligament through its inferior border. So this uterine artery will travel upwards in this direction, and it will be a content of broad ligament. It will be a content of the broad ligament. This is the uterine artery. So therefore, now here we are going to name the structures. This will be the broad ligament, and here we are going to name this as uterine artery, and we are going to name this as the ureters. Please note down these structures here. So inferior border is complete. So we have finished the presenting parts: anterior inferior surface, posterior superior surface, medial border, lateral border, upper border, lower border of broad ligament. The presenting parts are over. Now we consider this point, that is subdivisions. In the subdivisions we come across mesosalpinx. What is mesosalpinx? Now here, see here, this much area, I will term it as mesosalpinx. The portion of definition, the portion of the broad ligament. Sometimes you are asked in one more question answer, what is mesosalpinx? The portion of broad ligament which is present between fallopian tube and ligament of the ovary. That much portion will be known as mesosalpinx. And this mesosalpinx will contain, what are the structures present in the mesosalpinx? Ligament of ovary, fallopian tube, uterine artery, and similarly there will be another artery which is coming from above, and this artery here which I am drawing, it will anastomose here with uterine artery. This artery will be known as ovarian artery. So the anastomosis between uterine artery and ovarian artery it is present in mesosalpinx. And also in mesosalpinx there will be remnants, and these remnants I am going to show with the help of violet color. So here if I show the remnants just above these are the remnants if I show just above the ovary, and these remnants which I am showing 12 to 15 tubule like structure, they are the tubules of epiphoron, and similarly there will be presence of duct of epiphoron, and also there will be remnant of the tubules of parophoron. So therefore these are the contents. Now here I am going to mention this as epiphoron. Please note down epiphoron, and this I am going to mention it as parophoron. These are the structures which are present within the mesosalpinx part of the broad ligament. Very simple. So this is the fallopian tube, this is ligament of ovary, the anastomosis between the uterine and ovarian vessels, and the epiphoron, that is the tubules of epiphoron and the duct of the epiphoron, as well as parophoron. Mesosalpinx is over. So therefore this is mesosalpinx. This is number one, first subdivision of the broad ligament. Second subdivision of broad ligament, here where my hand is there. So this portion of the broad ligament, mesometrium, and this is subdivision number 2. The portion of broad ligament which will be extending between the ligament of the ovary and the inferior border of broad ligament is mesometrium. Contains uterine artery, tortuous uterine artery, the tortuous uterine artery. Third, now the third portion will be, this is the ovary, and we know that this ovary is related with the posterior superior surface of the broad ligament. So the anterior border of ovary, there is a portion of broad ligament which is attached between the anterior border, anterior part of the ovary, anterior border of ovary, and posterior superior surface of the broad ligament. And that portion which is attached will be known as, for example, if I show here, this is the part of broad ligament. Imagine this is the part of broad ligament which is present posteriorly. So this part of the broad ligament which is connecting posterior superior surface of the broad ligament with anterior border of ovary will be known as mesovarium. So I am going to write this as the third subdivision of the broad ligament, and here this will stand as mesovarium, and this will be third subdivision of the broad ligament. What will be structures which are present in mesovarium? As already we have drawn, structures that will enter the mesovarium will be ovarian vessels, ovarian artery. So ovarian artery is a part of the mesovarium, and mesovarium is subdivision number 3 of the broad ligament. What is mesovarium? Nothing, very simple. Connecting, it is a part of the broad ligament, connecting posterior superior surface of the broad ligament with that of the anterior border of ovary. And now the last subdivision, infundibulopelvic ligament, or it is known as suspensory ligament of ovary. Now here, in infundibulopelvic ligament or suspensory ligament of ovary, I am going to darken this. If I darken the upper part of the ovary and lateralmost part of the fallopian tube, and I give this attachment here to the pelvic brim. So this ligament which I am showing, which is attaching to the upper pole of the ovary and the pelvic opening of the fallopian tube, both the structures will be connected to the pelvic brim, and this is a part of broad ligament which is now known as suspensory ligament of the ovary, or it will be known as the infundibulopelvic ligament. So here I am going to write suspensory ligament of ovary, and I am going to give this as fourth subdivision of broad ligament, suspensory ligament of ovary or infundibulopelvic ligament. Now remember, all these four subdivisions, mesosalpinx, mesometrium, then the mesovarium and suspensory ligament of ovary, they are often asked in 1 mark question answers. After finishing these subdivisions, now we come up with contents. Now in the contents, please note down very fast what are the contents. So I am going to write I'm going to write here the contents. Here we are going to finish the contents on this side. So first content, you see the diagram and it will be very easy to understand. Content number 1, fallopian tube. So uterine tube or fallopian tube, this is content number 1, except its, of course, intramural part. Now content number 2. In the content number 2, there will be ovarian artery, so ovarian vessels. Content number 3, uterine vessels or uterine artery, ovarian artery. Then content number 4, the ducts of epiphyron, tubules and ducts of epiphyron. Now please note down the tubules of epiphyron, they are remnants of, these are often asked as 1 mark question answer in MCQs also. Tubules of epiphyron will be located just above the ovary, and these tubules are around 12 to 15 in number, and they are remnants of proximal mesonephric tubules. And the duct of epiphyron will be a remnant which will be known as Gartner's duct, or it will be a remnant of mesonephric duct. This duct of epiphyron will be, now this duct, if you just draw it over here, this duct will be present in this direction, and this duct will be known as a remnant of mesonephric duct. Then content number 5 will be the tubules of paruphyron, and these tubules of paruphyron will be located where? Just between ovary and the lateral wall of the uterus, tubules of paruphyron, and they are the remnants of the distal mesonephric tubules. That is content number 5. Then we come across to content number 6, very important, the round ligament of uterus. Please note down the round ligament of uterus. So therefore, if we draw the round ligament of the uterus, this round ligament of the uterus will be located, we know that it will extend from the lateral angle of the uterus. It is a content of broad ligament, and it will be crossing the lateral pelvic wall, and it will enter the deep inguinal region. So this round ligament of uterus here, which I have drawn, is present antero-inferior to the fallopian tube. Please note down, it is attached to the lateral angle of the uterus, but it will be related to the antero-inferior portion of the fallopian tube, round ligament of the uterus. So this is the round ligament of the uterus. And content number 7, now I am coming over here, content number 7, and the ligament of ovary, which already I have shown here. This is the ligament of the ovary, and this ligament of the ovary will be related posterior inferior to fallopian tube. So these two ligaments relations are very important. If this is the fallopian tube, then the ligament of ovary is related inferiorly but posteriorly. So posterior inferior to fallopian tube. And round ligament of uterus is related anterior inferior to fallopian tube. So imagine this is fallopian tube, posterior inferiorly will be ligament of ovary, and anterior inferior will be round ligament of uterus. Total 7 contents. Now 8th content. Content number 8 will be, there will be lymphatics, there will be nerve plexuses, and there will be the smooth muscles of the uterus. So lymphatics, nerve plexuses and smooth muscles of the uterus will be content number 8. And content number 9, this is sometimes asked in MCQs, accessory suprarenal tissue. Sometimes, very rarely, there will be presence of accessory suprarenal tissue, which is content number 9. So these are the 9 contents of the broad ligament, and here we finish the broad ligament. Thank you very much.